If there's one thing kids are really good at, it's getting sick. Your children, or maybe even yourself, have experienced an ear infection at least once in your life. I'm Dr. Adam Goodcoff, and today I'm going to explain how we get ear infections, the different types, and how severe they can be. Otitis externa is a condition where infection sets up in the outer ear. This often results from stagnant water after swimming, hence the name. The next condition, otitis media, is an infection of the inner ear. In the back of our throat connecting to our ear is a small tube known as the eustachian tube. In adults, this tube forms a steep incline from the back of the throat to the ear, meaning that it's hard for bacteria to flow backwards up towards the ear. In children, however, this tube is much more flat, allowing backflow of bacteria and frequent infection. So now that we understand the types of infections, how do they set up? And what do we do about it? Well, for otitis externa or swimmer's ear, we can use topical drops. These target the bacteria that set up in the outer ear. Inner ear infections, as you may remember from childhood, require oral antibiotic. This comes in the way of that chalky bubblegum tasting liquid known as amoxicillin. If the inner ear infections are left untreated, they can actually damage the eardrum or other structures in the ear. This can lead to temporary or permanent hearing loss in that affected ear. Sometimes, even with antibiotics, ear infections can continue to recur in children due to that angle of the eustachian tube. While it is uncommon, the infection can spread to an area behind the ear known as the mastoid air cells. This bony space is so close to the brain that if infection continues to spread, it can lead to an infection of the brain itself. Patients experiencing this, of course, would need to come to the emergency department and would also likely need IV antibiotics. Next time you or your child gets an ear infection, you will have a newfound understanding of what is really going on inside the ear. Be sure to let me know in the comments down below what topic you want to learn about next, and subscribe to have your health explained.